I think, as I mentioned earlier this morning, that globalization is actually not a very popular word these days, and it's unfortunate because it's a fact, undeniable fact, that thanks to globalization, it has opened a world of opportunities for billions on this planet, and it's our firm belief in Sun Pharma that it will continue to do so in future as well. So specifically to mention, I would say two opportunities which are relevant to us in Europe, basically as industry as well as consumers of healthcare. The first opportunity I see is around global sourcing of drugs, which has already helped European Union to reduce its pharmaceutical drug cost burden immensely, and we see this trend continuing going forward as well. Now, where we as Sun Pharma would like to partner with Europe, we have been in the forefront of this global sourcing of drugs, and we see this continuing, and we would like this partnership to be strengthened in future as well. And thanks to this, we see more patients getting more and wider access to medicines within Europe. The second opportunity for Sun Pharma is actually to help Europe tackle the scourge of drug shortages. There are a number of reasons for drug shortages, but one important one is that there is not enough capacity in Europe to manufacture and produce sterile injectable products. We at Sun Pharma have specifically been building and expanding our capacity to manufacture sterile products, specifically in the fields of antimicrobials and oncology products. And these are the two areas which are actually the most impacted by the shortage issues. What we have is we have built dedicated manufacturing plants for cytotoxic oncology products as well as high-end antibiotics, and we are available to bridge the gap between demand and supply of these products in Europe. Now, obviously, where there are opportunities, there are also challenges, and the first challenge which we see is thanks to relentless price pressure in Europe on the industry, which has actually led to consolidation among suppliers, producers of key inputs, including APIs. And what is happening is that because of this consolidation, there is perhaps an over-reliance on a few suppliers. And when there is a supply interruption in one of such suppliers, now this supply interruption could be because of compliance or any other issue, it leads to immediate domino effect globally. And we have seen there are more than one example in the recent past. Now, while we as Sun Pharma actually got an opportunity from this because we were not implicated in this particular issue, but we see it could well happen in the future, and which could be a spoiler. Now, I don't want to go into the discussion of whys and hows of pricing pressure. Perhaps we'll need a 2-hour interview separately for that. But basically, I would like to focus on the issue of what regulators can do to make sure that there is enough strength, regulatory strength built in Europe to ensure inspections happen on time. Because we have seen and we have ourselves suffered on that scheduling inspections take a very long time, which really prevent approval of new products and so on and so forth. We also see a challenge in getting priority review of source switch applications, especially when there are acute shortages. So I think this is also another area where regulators would like to see. The second challenge which we as Sun Pharma, but it's not just limited to Sun Pharma, it's all for our entire industry and regulators to basically jointly work together to reduce the burden of environmental burden, basically because of our industry, our manufacturing. And this should happen without compromising patients' access to drugs. And I think that's where the challenge lies. We have seen in recent last 1 year a number of API plants closing down in China by the Chinese government. These were the polluting plants, so obviously it's great news for Chinese people, but not so much for the global pharma industry, because everyone is sourcing from China, and obviously it has led to shortages. Obviously, for us as Sun Pharma, we have reacted by starting to produce many of these API ourselves, because we had all stopped, as I mentioned, thanks to consolidation, thanks to cost reduction pressures, we had all stopped. But now we have made sure to restart some of these so that we can again get into the market with these products, even if it means at a higher cost. At the same time, in the same way, we would like our regulators and payers to reach a common approach, a consensus on how to address another problem of environment, which is antibiotics in water. And I think here there is a need for the payers and the regulators to come together and reach a situation where industry can anticipate what each one will do, so that we can have a common understanding of this important issue. So I think these would be the key opportunities and challenges for Sun Pharma in Europe. Going our own way has never worked and never will work. In fact, the world is all about collaboration, no matter what the political wind is saying these days. I think we have to ensure that we all collaborate, whether we as producers and marketers of drugs globally, or regulators here in Europe, in India, in China, in US. So I think there is immense gain to come from collaboration. There is absolutely no doubt about that.